Hi, I'm Dr. Dai Chung, Chief Medical Officer of the Joint Pediatric Enterprise between UT Southwestern and Children's Health. Welcome to this new segment of the In the Know video series. In these videos, I'll sit down with various physicians to shine a light on the clinical excellence, innovation, and medical advancements that are happening across our enterprise. I look very much forward to sharing this incredible work of our colleagues to transform pediatric healthcare in North Texas and beyond. We have with us Dr. Jake Jaquiss, who's Professor of Surgery and Division Chief of Pediatric and Congenital Cardiothoracic Surgery at UT Southwestern and Children's Health.
Thank you very much. Pleasure to be here.
Tell us about your program.
I'm one of the co-leaders of the Heart Center, which refers to an organizational construct that has a group of pediatric cardiologists, pediatric cardiac anesthesiologists, pediatric cardiac critical care doctors, and pediatric cardiac surgeons. And I'm the leader of the surgical team as well. There are three of us who do congenital heart surgery here, and we are among the largest programs in the country by volume of work that we do, by catchment area that we cover. And we pride ourselves in pretty much taking care of the entire waterfront of cardiac procedures and conditions and needs that any child or adult even with congenital heart disease might have.
So you mentioned Heart Center. It's got to be a unique sort of setup within a children's hospital. I wonder if you can elaborate a little.
Yeah, I think one of the things that attracted to me about the business originally was the incredibly tight cooperation between multiple specialists. In the last 10 or 15 years in medicine, the term multidisciplinary has become very common. A lot of medical conditions, for children and adults, require input of multiple specialists. But to have that input be coordinated and seamless and synergistic requires a fair amount of organization. And one of the things that attracted me to congenital cardiac care originally was that this has been a part of the specialty and of the profession really since its origins in the 1930s. Our Heart Center is the literal organizational manifestation of that, and it has the various components that I mentioned, but it also includes a large number of people, nurse practitioners, other advanced practice providers, nurses, therapists, pharmacists, social workers, all of whom have the common interest in caring for people who have congenital heart disease. I think we have about 450 people in one form or another who would identify themselves as being part of the Heart Center, if not exclusively, then for a significant component of their professional activity.
That's great. It's a large team of all key providers.
Yes.
So what is it about heart conditions in babies and children that you think that really this sort of a setup is so critical to deliver the highest quality care?
Well, as a cardiac provider, I naturally think the heart is the most important organ in the body, and I have plenty of colleagues who would argue with me about that. But we would all agree that the heart doesn't work in isolation. It works with lungs. It works with all of the other organs in the body, and to kind of make a symphony. And you can know a lot about the heart, and the more you know about the heart, the truth is really that the less you might know about other things. The more specialized you become, the more dependent you become on other specialists with other associated expertise. And so there is a need for specialization and coordination.
That's great. So with that, what are some key sort of mission or strategic goals to sort of expect out of the Heart Center and your program for the next foreseeable future?
Well, I think that one of the things that we've come to realize, and it's been an evolution of thought, is that this hospital and our Heart Center, for that matter, began in response to a local need. There are a lot of people in Dallas who have children who have congenital heart conditions, and there's a need for those children to be cared for. But because all things in Texas are big, there's a big need for that, and so we have a relatively high volume program. What that gives us, not uniquely, but there are only a few other places in the country that have the volume that we have, it gives us the opportunity to develop an experience and an expertise that positions us to improve the overall state of the art. If you see something once every 2 or 3 years, it's difficult to be good at managing it. If you see 3 or 4 of that same unusual condition in a year, you will much more quickly get expertise in it than what I expect we will be doing in 2025 or 2030. But if we are going to change what we do and improve what we do, someone has to be in charge of that, or someone has to be positioned to do that. And so we think that we are positioned, as very few others are, to change the way things are done for the good. And that is a very, it's a responsibility, but it's also very intriguing and exciting, and it allows us to attract people who are bright and committed to this area of work, and who are the kind of people that are going to change the paradigm.
Well, I think that's a very inspiring goal, to be the best, to be the sort of provider for kids and infants with cardiac conditions. So with that, what are some innovative programs in your division?
Well, one of the things that I think that we really are national, if not international leaders in, is in the management of children whose hearts have failed. And that can happen for a variety of reasons. That group of conditions creates what we call end-stage heart failure. And traditionally, that was managed by a bunch of different doctors, each with his own or her own idea about how that ought to happen. But about 10 years ago, the science of heart failure in children became recognized. And we have a group of cardiologists who are particularly expert in that. But as good as they are, and as good as the ever-changing menu of medications and strategies to manage those conditions are, eventually they will fail, and we will need a mechanical solution. And that's where surgeons come in. Traditionally, the mechanical solution for a failing heart is a heart transplant. But sometimes people need heart transplants much more quickly than one will be available for them. And then we use something called mechanical circulatory support, which in the simplest terms is a pump that keeps the patient alive while their heart is not able to do the work that it should have been able to do, and that eventually a heart transplant will do. And so we have really led the way in modifying those pumps and creating some very imaginative reconstructions to allow those pumps or other pumps to function. And so we have an incredibly busy transplant program, and we have an incredibly well-developed heart failure program. And as this has developed, it's a little bit like the Field of Dreams phrase, if you build it, they will come. And so the heart failure team has become increasingly known as expert in managing a variety of very unusual and exotic causes of heart failure. So this is an area of really nearly spectacular growth over the last several years. But that's one area that we're very focused on innovating in.
What about relative to the region? I mean, what sets our program apart, and why should families from the region come to CMC Dallas to get heart care?
From a technical resource, expertise standpoint. So do we have the fanciest machines, the newest drugs, the largest operating rooms, the best of everything? Is the physical organizational plant among the best? I would say, without meaning to brag, but I'm going to do it anyway, if I were to take any of my colleagues who do what I do at other institutions around the country and give them a tour of our heart center, there are very few, which is to say almost none, who wouldn't trade what they have for what we have. So somebody who's thinking about why should we come here, we have an incredible place to be taken care of.
So is it fair to say that we truly indeed have one of the best pediatric heart failure programs?
Absolutely, without question. Yeah, it's one that we're very proud of. When I moved here nearly 6 years ago from another leading medical institution, and I came in to meet the heart failure group at one of their several weekly meetings, I walked in and there were 25 people in the room. And the place that I had come from had a similar meeting that was attended on a good week by 5, many of whom were part-time. So I came in and saw social worker, pharmacist, occupational therapist, etc., people that we normally didn't see. And so our success is not exclusively medical. It's very much dependent on all of the other support teams that go into making a life for a child with heart failure a real workable life.
What should our colleagues and employees and staff know about you and your programs that perhaps may not be so readily visible or apparent?
The people that I work with are spectacularly good at what they do. We also recognize that we are very much part of an organization that supports us and other programs of excellence in a way that makes what we do possible. Transplant patients, for example, are notoriously tricky, unpredictable, and able to become ill in ways that no one before has seen. And so sometimes those ways of becoming ill involve getting an unusual infection. But we have an incredible infection team here, infection control team, and an infectious disease team. So people who are experts in exotic infections that I never heard of before. We can't succeed to the level that we have and aspire to without that kind of support. And that is true across every medical specialty. So I guess what I'd say is we're very proud of what we do, but we're also very proud and grateful to have the setting that we work in and the people that we work with.
While you're leading one of the best programs in the country, to have that humility and sense of sort of togetherness is also so important. Great. Thanks, Jake.